Okay, so we have gone Facebook Live. Welcome everyone. Today evening, we have two presenters with us. Sneha Prem, who is from Tufts University, who is an MS candidate there, and Ellison Leader, who is from Massachusetts University, who is a dental hygiene student there. Both of them have been trained under Dr. Leader. Dr. Leader is a very eminent personality in scleroderma world. Dr. Leader has been giving presentations with Scleroderma Foundation US, and he has been associated with Scleroderma Foundation and Spin Foundation Canada. His contribution to a lot of research work is a commendable work for which we are grateful for all the dental work he has done so far for the scleroderma patients. Welcome all three of you today, and I welcome all of you who has joined us today evening to listen to this session today. Thank you so much. Ellison, you can please share your screen now.
All right.
All right. Thank you so much, Neetu, for that introduction. And thank you to all of you who are here to listen to us, and Happy New Year. So I am Sneha Prem. As Neetu said, I am a dental candidate studying at Tufts School of Dental Medicine. And go ahead, Allison.
And I'm Allison Leader. I'm a dental hygiene student at the Forsyth School of Dental Hygiene in Worcester, Massachusetts.
And these are just some pictures of our respective institutions in Massachusetts.
I hope everyone is able to see the presentation. I have pinned Ellison's screen on. So in case you are not able to see that, you can pin Ellison's screen.
And this is just to say that Sneha and I, neither of us have any conflicts of interest with the products or programs that we will be discussing in our presentation.
So we are here to talk today about scleroderma's oral effects and how they can affect your oral health and your overall health. So scleroderma is a systemic autoimmune condition involving the overproduction of collagen, which is a type of protein that's found everywhere in the body, but particularly in the skin. And so this results in the classic presentation of skin tightening with a range of severities. And so this skin tightening presentation is particularly evident in the head and neck region. And this can result in something called microstomia, which is having a smaller mouth opening. Sclerodactyly, which is tightening of your fingers and feet, and Raynaud's phenomenon, which is having reduced blood flow in your fingers and your extremities, essentially your fingers and feet as well, and it makes them more sensitive to colder temperatures. Collagen is also present in the mouth, and so scleroderma can cause gum disease, which is essentially gum tissue pulling away from the tooth structure. And individuals usually with scleroderma take medications that have dry mouth as a common side effect. And so this can put individuals at risk for cavities, candidiasis, which is a fungal disease, gum disease, and something called dysgeusia, which is a change in the sense of taste. Individuals also can experience muscular pain all over their body, particularly in the mouth, near their joint right here, the temporomandibular joint. And this can make chewing and swallowing challenging sometimes. And lastly, but most importantly, this condition can really take a toll on one's mental health, including depression, anxiety, and increased stress as symptoms. And we can't emphasize enough how important mental health is in helping aid good oral health and overall body health. As you know, life itself presents many everyday challenges to everyone, and adding this condition on top certainly brings on other challenges that individuals must adapt to, be innovative with, and just generally experience life in a different way than they're used to. And all these symptoms are related to one another. And what I mean by that is that if one of these areas pose extra difficulty, it can cause other issues in your health as well. So for example, if you're having trouble maintaining good oral hygiene and you have daily chronic pains in your oral cavity and in your body, it can make things like eating harder, which can affect your overall health, your nutritional intake, etc. So all of these things are related. And so it's important to address all these different aspects and tackle them one at a time so you can regain as much control as you can over this disease. And so we are here to help you find small ways to make it easier for you to take control. Next slide, please. So these are just two images showing the dental effects of scleroderma. The first image shows the gum pulling away from the teeth structure, and that's called recession, and that can lead to sensitivity, gum disease, and cavities. And the second image is an X-ray that shows bone removal, which is called resorption. And this can be monitored by your dentist through regular X-rays, routine X-rays. And so you would want to make sure that your dentist monitors these carefully and takes frequent X-rays at your dental visits. Next slide, please. So as you know, microstomia and sclerodactyly combined can make cleaning difficult at home and at the dental office. And so that's due to having a smaller space to work with and difficulty holding the toothbrush. And Allison is going to talk about some physical therapy exercises to help relieve the tightening and the pain that you feel around your mouth, and some common adaptations to the toothbrush that'll make brushing a lot easier.
So here are a couple examples of simple physical therapy exercises you can do on your own to help with that opening of your mouth and jaw. So first of all, it's very important that you lubricate your lips, get them nice and moist, use just, some nice lip balm, Vaseline, coconut oil, something along those lines to just help protect the delicate skin there. And this first exercise, what you do is take your hands, cross your arms at your wrists, and just gently insert your thumbs at the corners of your mouth and just gently stretch. Now, you don't want to feel any pain or discomfort. You just want a gentle stretching feeling, and just hold it like that for a little bit, however long is comfortable. And this is one that you can do while you're sitting on the couch or when you're in the shower, having that nice steam, also helping relax the skin there. And now this second exercise, what you need for it is a stack of tongue depressors, those really big popsicle sticks you see at the doctor's office, and take a stack of them as wide as you can open your jaw, the space between your teeth, and rubber band them together and stick them in between your teeth. And again, no pain or discomfort, just a gentle stretching. And when that no longer stretches anymore, take another popsicle stick and insert it into the stack just to get that gentle stretch back. And this nice and slowly will help you open just your mouth and jaw a little bit wider. And the second one especially is one that you might want to ask someone for help with too. And there are tools that can help with these as well, but this is just ways that you can do it for free on your own. Now, when you have that limited amount of movement in your hands, it can be difficult to find a toothbrush that works well for you. On the left here, I have a picture of different ways people have modified their manual toothbrush, just the plastic one that they give you at the dental office, to make it easier for them to use. Personally, I really like the tennis ball with a hole in it. It gives you a nice, wide, grippy area to hold on to, and it helps you manipulate that toothbrush a lot easier. But also the market standard now for an adaptive toothbrush is an electric toothbrush. And the thing is, an electric toothbrush, the way you brush with it is a lot different from how you brush with a regular toothbrush. So if you do get one, be sure to bring it with you to your next dental appointment so that your dentist can show you the correct way to be using it. But if you can get one, then it's a lot easier to use than a regular toothbrush.
So GERD is also a very important and common symptom found in scleroderma. And GERD is caused by a weakened lower esophageal sphincter or valve. So the esophagus is a long tube that essentially extends from the mouth to the stomach. And that's the passage of food, starts from the mouth and goes to the stomach. And as the food is being passed down into the stomach, the valve opens and closes as a result. But when this valve gets weakened due to the effects of scleroderma, some of that stomach acid and food content can go back up and cause symptoms like nausea, problem and pain swallowing, erosion of tooth structure, and ulcers in your esophagus. And so especially it's important to have your doctor monitor any signs of ulcers frequently and make sure to pay attention to any erosion that's happening in your mouth, because you don't want that to get exacerbated too much. Next slide, please. And so here are some lifestyle changes that you can make to help manage the symptoms of GERD. And so one of them is raising the head of your bed by putting a stack of books under the head. That way you're not lying completely flat. And so the effects of having that stomach acid going up won't be as severe. Definitely stop smoking. Smoking is bad for most areas of your health. And so smoking also exacerbates GERD effects. Creating smaller meal portions is also really helpful. That way your stomach isn't challenged with trying to digest such a heavy meal, which can often lead to GERD episodes. Definitely you should not lie down right after eating. You should give yourself 2 to 3 hours sitting up to digest all that food. And lastly, very important to the erosion of tooth structure or the removal of tooth structure, you shouldn't brush your teeth right after a GERD episode. You should, if you feel the need to clean your mouth in some way, just swish some water around in your mouth. But if you brush your teeth, it actually shows that it takes away even more tooth structure. And so you want to stop that as much as possible, because weakened tooth structure can lead to cavities and things like that. Next slide, please. And some dietary changes that can help manage GERD as well include limiting alcohol consumption, and the spice level of your food may change as well. I know Indian food is really spicy and we love our chilies, but spicy food can be quite irritable on your stomach. Spices like turmeric and hing and stuff like that is fine, but usually like having lots of chilies in your food can cause quite a lot of irritability in your stomach. Acidic foods like orange juices, soda, tomato juice can cause GERD episodes. Caffeine, chocolate, high fat containing foods, and mint have all been shown to cause GERD episodes as well. But as always, you should just listen to what your body tells you. Some of these foods may not pose a problem for you, while other foods may. So you should always just monitor what you're eating, see how your body reacts, and always eat everything in moderation. Next slide, please. So now Allison is going to talk about how to prevent cavities and gum disease.
So our standard recommendations for every patient are to brush your teeth twice a day with a fluoride-containing toothpaste and to floss once a day. I will go into more detail on different types of toothpaste and flossing methods further down in the presentation. Also, drink lots of water to help with that feeling of dry mouth a bit. If you can, suck on sugar-free hard candies to help stimulate those salivary glands. And there's also more mechanical methods to help remove some of that extra bacteria, the gunk in your mouth, like tongue scraping and oil pulling. So one of the most significant symptoms oral health wise experienced by patients with scleroderma is xerostomia, also known as dry mouth. And here's just a few recommendations to help with that. So a sugar-free mint, especially sugar-free mints with xylitol, can suck on them to help your mouth produce a bit more saliva. Here in the United States, I have heard great things from scleroderma patients I've talked to about xylomelts, especially, and there's also other over-the-counter gels and rinses, such as the Biotene dry mouth gel, that can help combat that drying sensation. And not everything that will make your mouth salivate is necessarily helpful. So a sour candy or a nice tart citrus fruit, that's gonna make your mouth salivate, but you're also getting a load of that acid that's gonna weaken your enamel, and sugars that's gonna feed the enamel eroding bacteria inside your mouth. So the next step after you pick your toothbrush is picking the right toothpaste. So for a patient with dry mouth, I would definitely recommend they look for a toothpaste that's SLS, sodium lauryl sulfate free, such as Biotene, or in Europe, another popular one is Squiggle. And SLS is an industrial degreaser. What it does in your toothpaste is it makes it that nice foamy sensation, but it's also extremely, extremely irritating to your oral tissues, especially if you're a patient with dry mouth. So you might also want to ask your dentist about professional strength products, such as MI Paste and Provident. And these professional strength products help to remineralize. That means to, sort of patch up and help fill in those weakened areas on your enamel and help rebuild the surfaces of your teeth, make them nice and strong again. And doing that helps prevent cavities and reduce sensitivity that you might be feeling in your teeth. So again, with the weakened mobility in your hands, using a regular string floss between two fingers might not be an option for you. So here's a couple alternatives. On the far left, I have the Waterpik Power Flosser, not the water flosser. It's basically an electric toothbrush handle with a plastic toothpick on the end that you replace, and you stick it between your teeth. And there's a button on the side that makes the tip vibrate, and it does the flossing action for you. And in the middle, we have the Listerine Ultra Clean Flosser, also sold as the Reach Access Flosser. And it's basically a toothbrush handle with a replaceable floss head on the end. And now this you can modify the same way you might modify a manual toothbrush handle, like I showed in a previous slide. And this you put on the clean floss head and then put it between your teeth and do that up and down motion against each side of the teeth in that area. And that flosses your teeth pretty well. And then on the far right is another flossing handle that I found while looking on Amazon. And it's a refillable one where you put the spool of floss into that round part of the base, thread the flosser, and it works the same as the Ultra Clean or Reach Flosser. And with this one, you don't have to buy the head refills like you would for the Waterpik or the Reach Flosser. So tongue scraping, it's another easy way to reduce the amount of bacteria in your mouth. It can help you improve your sense of taste, combat that dysgeusia symptom. It mechanically reduces the bacterial load in your mouth, and doing so has the dual job of both reducing bad breath, and it helps reduce the chance of cavities and gum disease because you're mechanically getting out of there those little bad bugs that are gonna be causing those problems.
And so in addition to tongue scraping, oil pulling is another popular Ayurvedic method, and it particularly helps with gum disease. And so this is also in the same principle, reduces the bacterial load in your mouth, or all the bad germs that can cause gum disease and cavities and such. And this has the additional benefit of lubricating your mouth or making it nice and moist, which can help combat that feeling of dry mouth as well. And so how you would do oil pulling is you would place a tablespoon of oil in your mouth. People have used sesame oil and coconut oil, and just swish it around in your mouth for as long as you can. Some people can do it for a really long time, but of course, you know, there's a lot of discomfort with chewing and swallowing in patients with scleroderma. So just do it as much as you can. And spit it out in a trash can when you're done, and just continue your normal brushing and flossing habits. Next slide, please. So physical therapy and massages are really great for individuals with scleroderma because it'll help regain some of the mobility and help ease some of the general body pains that they may feel. And Yoga for Scleroderma, as you may know, is a wonderful organization that provides many demonstrations, video tutorials, and exercises on how to help with your physical therapy. And with that said, you should definitely have a friend or a sibling or a parent help you with these exercises, and also consider getting frequent massages by a professional. And here is a small clip from the Yoga for Scleroderma site showing you a hand exercise that they use.
Yeah. Then you're going to bring your fingers as far as they'll go, and you're going to put these fingers on top there. Now it's the push. So you're going to push, but I'm the one holding the resistance so that you're getting that big flexion.
Where am I supposed to feel it?
Here. Good.
Okay, good. Okay. I am.
And lastly, we really want to emphasize how important mental well-being is in its role in scleroderma and in life, of course, in general. And so seeing a psychologist or a therapist, or even joining support groups like the wonderful Scleroderma India, can be really helpful in managing the everyday challenges of living with scleroderma. And as you know, there are a lot of changes that happen to an individual's body when diagnosed with scleroderma, and that is a major shift and change for a lot of people to handle, and it can be quite overwhelming at first. And things like body image and self-image are related and very connected to self-esteem. And it's really important to talk to someone, especially someone that's going through the same process as you, to help understand all the processes and changes that are happening, and so you can make some understanding of how to go about these challenges. And lastly, knowing your limitations and giving yourself the needed rest is especially important, because you don't want to exhaust your body too much. You just want to give yourself enough time to heal and just go about your daily tasks, calmly without any pain. And so meditation is a wonderful way to manage stress and anxiety. And so I would like to take a minute to follow this meditation guide again from Yoga for Scleroderma.
Another common and very helpful breathing practice is called Nadi Sudhana. So this is one hand form. You put your first two fingers down, and if you can't do that, there's alternate ways you can use your hands. You can even just use a finger here to close one nostril, breathe in, breathe out, close this side, breathe in, and breathe out. Or you can just use your hand like this, as I know there's a lot of hand involvement in scleroderma. So I'm going to practice this technique for you so that you can see how it works. So I'm going to take a deep breath in.
So approaching your dental appointment, it can be kind of stressful, going to a dental professional and saying, these are things you need to know. This is how you might need to change treatment for a patient like me. So I just wanted to make a few recommendations for what you should do to make the experience smoother for both you and your dentist. So first of all, it is very important that you tell your dentist your whole medical history. Bring a list with you of medications you take and your healthcare providers. You might forget some of them day of, or the spelling of the medications might be hard and the dentist won't be able to find it. And these are different things that might affect how and what the dentist might use to treat you while you're in their office. Next, I can't speak for India, but in the United States, especially nowadays with all of the additional protective equipment we're wearing, the dental office is usually very heavily air conditioned. So I would recommend that you bring a sweater or a blanket with you, maybe a pair of gloves if you experience the Raynaud's phenomenon. Or when you go to the office, make sure to ask them, can I sit in a chair that isn't directly under an AC vent? Or even if they could turn the air conditioner off just for the period of time that you're sitting for treatment in their office. Now, it's also important to schedule your appointments around maybe your meal and medication times, whatever is most comfortable for you to receive treatment. The dentist should be working to when is best for you to receive treatment, not when is best for them to give you treatment. And if you need breaks during the appointment, let your dentist know, or even see about scheduling shortened appointments over a longer period of time, if that's the healthiest way for you to receive your treatment. And again, I'd like to recommend to ask your dentist if a prescription fluoride toothpaste should be prescribed. Again, to help with that dry mouth, that remineralization, patching up of your teeth. And make sure your x-rays are updated every year at least. That thin bone along your jaw is one of the first places that you can see progression of scleroderma. So it's exceptionally important to have your mouth x-rays taken so all of your medical team can know this is where your disease is at.
So thank you so much for attending this presentation. We hope you learned a lot. And we would like to thank the Scleroderma Foundation, our mentor, Dr. Leader, which is also Allison's dad.
Thanks, Dad.
And we would like to thank Neetu as well and she's a co-founder of Scleroderma India, and she's an inspiration to us and for this presentation. So thank you so much. And if you have any questions, we can take questions as well. Oh, sorry, one more thing.
Oh, yeah. This is just our Scleroderma Oral Health brochure. It's available on the Scleroderma Foundation website, scleroderma.org. And it's just an example of one of the many resources that the foundation has available for patients and their healthcare providers, so everyone can sort of understand better this is the type of treatment, the type of modifications you would need to help a patient with scleroderma.
And we will give you the PDFs for this presentation and for that brochure as well, so you can read them at your own time. So thank you so much.
Thank you, Sneha. Thank you, Alison. Thank you for such a wonderful presentation. The idea behind the whole presentation, which I really liked, is, it is more of a holistic kind of a thing, where not only the dental part, but the kind of stress which we get, like we lose our confidence, and, because our looks change because of all these dental issues, we need to have a holistic approach how to handle all these things. And very beautifully, you covered them. I would actually like to invite the questions. If anybody has any question, they can unmute themselves. Rights have been given to them. And in the meanwhile, I've got few questions on my personal chat, and I would like to start with them if you may ask me to start.
Yeah, sure. Yeah, we can start our Q&A.
Okay. So the first question which I've got is for the taste change. Like a lot of people experience that their taste changes, during the course of the day also. So we talked about one remedy over there, scraping the tongue. Is there any other thing which can be done around oral health which can help?
So the oil pulling method can also help with that change, that sense of change in taste as well. You can also just, you can like clean your tongue, I guess, multiple times a day also if you're getting that feeling progressively throughout the day. And if there's something that exacerbates it more or makes it more evident, you can adjust, your oral hygiene habits accordingly. And so I don't know, Allison, if you wanted to
I
recommend
mean, in some cases, just doing your best to stay hydrated can also help. Just drink a lot of water if that's not something you're already doing.
Okay, that's very sound advice. Okay, the another question which I have is, we talked about physical therapy. How often can we do that physical therapy? Like how often in the day should we be doing that?
You can do it up to multiple times a day. If it's comfortable for you, just, don't make yourself sore with it.
right.
Okay. My next question is, we have talked about prescription fluoride toothpaste. So is it something that we need to make sure we all should be checking with our doctors, and we just cannot go to the market, or we can't order, and we should not be doing it ourselves, something of that sort?
Yeah, you should definitely make sure like your dentist suggests a good fluoride toothpaste, because the fluoride toothpaste that is the prescription grade level, it has a higher amount of fluoride in it than your common toothpaste. And so you don't want to have too much fluoride, because that can also cause issues for your teeth as well. So you don't want to do too much or too little. You kind of want to be just right. So your dentist is going to be the best gauge as to whether your teeth need that extra fluoride or not. So just make sure that if you're really concerned about the state of your teeth and you think you're losing a lot of tooth structure, just ask your dentist, hey, do you think, I could benefit from having a prescription fluoride? And if they say yes, this is a really good prescription for you, you should get it, then you should go ahead and try it out. But I wouldn't start medicating or trying to do it like, pre-medicate or anything like that.
Sure, sure. So the next question which we have got is, if there is any way or any medication by which gum shrinking can be stopped or arrested.
I'm sorry, say that once more time. The connection was.
Is there any medication by which gum shrinking can be stopped?
I don't know of any medication. Do you, Allison?
That is not my area of expertise.
Yeah, no. Yes, and Dr. Leader just gave me a chat. Yeah, so no, there's no specific medication to help combat gum recession. Yeah, that's just something that has to be monitored frequently, and your dentist will help you in monitoring that as well. And if it gets to a point that it's too severe, the recession, then maybe you can talk about dental treatments that can help with adding some additional gum tissue, but there's no medication that you can take.
Would it be all right if I just made a comment on that, Sneha?
Yes, please. Yeah.
Hi, this is Dr. Leader. I can't get my video to work. I'm sorry. You'll have to just stare at me and my motorcycle. Yeah. So as far as gum recession goes, there's two reasons that people who have scleroderma get gum recession. One reason is from brushing your teeth too hard. So be sure to use a soft bristle toothbrush and be thorough, but be gentle. And the other reason is the same way that scleroderma causes tightness in the skin in your face and in your hands, it can cause tightness in the lining of your mouth. And as it tightens up the lining of your mouth, it can pull the gum away from the teeth. So some dentists can do a special kind of surgery, which is just very shallow cuts. And please don't do this yourself, but very shallow cuts into the lining of the mouth called releasing incisions. And this gives the tissue more mobility and makes it so that the tightening of the tissue doesn't pull the gum away from the teeth so much.
Right, Dr. Leader, that's very interesting to know. So we do have some procedures to fill up the already existing gaps between gums and tooth if somebody has got really severe issues around this part. Right. So I will move on to the next question. A few patients, they feel that their tooth is breaking. It is not that the tooth has come out entirely, but it is actually breaking into parts. So is there anything which can be done around that?
Dr. Leader, do you want to take point on this as well?
Sure. There could be a lot of reasons that teeth might be breaking. It might be that you have tooth decay and that's weakening your tooth. And it might be, I just had the experience where we know in the United States that the stress about the pandemic is causing people to grind their teeth more. And I've actually broken one of my teeth from grinding. And now I have to have that poor tooth taken out because the root is fractured. And so it's not just me. I've heard of this happening to many of our patients. In a case like that, there are things that you can do, like ask a dentist to make a device that would go in between your teeth so that you don't grind them together. One of the things that I do is when I'm going to sleep, because I know I grind my teeth at night more, I put my tongue in between my teeth so that it's sort of I'm not going to grind on my tongue. So that protects my teeth quite a bit. And although it didn't save this one tooth. And if it's from tooth decay, then seeing a dentist is the only way to really fix that.
Right, Dr. Leader. Right. So moving on to our next question. Shruti says that she has bright yellow teeth. A dentist has told us that it is because of the loss of enamel. So can bleach wash make them white again?
I would personally not recommend using bleach wash. In the United States, at least, it's normally a hydrogen peroxide sort of wash, especially due to loss of enamel, because it's going to exacerbate the problem, if anything, make it worse. Because already what these products do is kind of remove the top stained layer. So it's just going to be removing more and more of that. But with loss of enamel, that is one of those things where you might want to ask your dentist about getting a prescription fluoride toothpaste to help build that enamel back up.
Okay, so is it possible Right, Alison. Is it possible that after getting the prescription fluoride toothpaste, when we feel that enamel has started building up, can we get the teeth whitening again somehow? Because that's again a very, stigma for a lot of people.
Yeah.
Because your personality changes. It's very difficult, to speak to a lot of people because you are always conscious. Anything which can be done to make teeth white again.
So you can also your dentist can make something called veneers, which is just like they'll take a little bit of tooth structure and they'll create like essentially a new surface for your tooth. And with the shade that is more, I guess, whatever you desire, more white, I guess. And so that can be something that you can ask your dentist to see if they can do that for you, if aesthetics is a big concern. But really building up that enamel tooth structure is really important just for your general like oral health. So your teeth are strong enough essentially to continue just your daily functions of chewing and eating. But veneers is another option. So you can ask your dentist about veneers.
Right, Sneha. So our last question of today's session is, Shruti's teeth are moving apart from each other. Like, there's a lot of gap which has come. So will braces help in this condition, considering she already has scleroderma?
So it depends on the progression of the scleroderma. You want to make sure, this is also something that you can talk with your dentist about. You want to make sure you look at the x-rays to see if there's not too much resorption or bone removal. So braces can be okay depending on how much bone is left in your mouth. And so if your bone level is great, then yeah, it should be fine. But if you don't have enough bone in your mouth, then braces is not a good option. So it really just depends on the state of your mouth at the time. So you should talk to your doctor or to your dentist about that.
Can I add one more thing? I am Shruti. This is my query. And along with this gap between my teeth, there is one more problem. I have done 8 root canals. And all are my, this last tooth, most of them are, last and second last of all 4 sides. So will in that case braces help? I mean, because I don't know how it works. So will it be a good idea to even approach a dentist in this case?
So I think it should be fine, right, Dr. Leader, as long as the bone is at an appropriate level.
So thank you, Sneha. The root canals in patients who don't have scleroderma are usually done for a couple of reasons. One is that you've had trauma to the tooth, so something hit the tooth and damaged the nerve of the tooth. Another thing is you might have had a cavity, and the cavity causes an infection inside the root canal. So if these are the reasons that you had the root canal treatment, then that's absolutely fine and doesn't affect having braces or doesn't affect having orthodontic treatment or braces to move your teeth. But sometimes people who have scleroderma have a problem where your own tissue, either inside the tooth in the root canal or outside the tooth in the gum, starts to eat away at the tooth. And we call this resorption. So if you had the root canal treatment because of internal resorption inside the tooth, having braces might not be a good idea. It might exacerbate the resorption. Also, if you have external resorption or resorption outside the tooth, having braces is not a good idea.
Thank you so much. Thank you.
Thank you, Dr. Leader and Sneha. Thank you, Shruti. Another question we have is, there's a query from some patient. When she takes cold and hot things, she can actually feel it in her mouth and she can actually feel it on her teeth. What precautions can the person take? And if there are any medicines they can actually take for this?
So for that, that's definitely something you would want to talk to your dentist about getting one of those prescription toothpastes for, because often that sensitivity is happening because the surface of your tooth is weakened and the pressure changes that happen in the structure of your tooth when you have something hot or cold is pressing on the nerve inside your tooth, which causes that discomfort when you have something icy or something super hot. And that's really uncomfortable. There's also, in the United States at least, there's over-the-counter toothpastes that are special for treating tooth sensitivity. The most common one here is probably Sensodyne, and those have ingredients in them that can help sort of, plug up that problem and reduce the sensitivity. But a more long-term solution you would get from using one of those prescription toothpastes from your dentist.
And also just make sure you address this to your dentist. The sensitivity could also be a sign of tooth decay or gum recession. So just you make sure you address those concerns with your dentist so he or she can see what exactly is going on in your mouth and then make appropriate treatment plans in accordance to what the problem is. But most often it is because of the loss of tooth structure. And so the prescription fluoride can help with that, but just make sure you talk to your dentist first so they can identify the problem.
Right,
also,
Sneha?
oh, sorry.
No, yes, please carry on.
Oh, no, Dr. Leader he's like sending me messages. If you guys also have additional questions or any other concerns, I'll put my email in the chat for everyone to reference. Allison, if you'd like, you can also put your email as well. You can ask Allison as well.
Sure.
And we'll be happy to, answer any other questions you have. If you can't think of anything right now or you think of something later.
Right. So another question we have got is that the patient's tongue has permanent discoloration, and these days the tongue tips gets numb and white because of possibly Raynaud's phenomenon. So anything to worry about or anything which can be done around this?
I'll take that one.
Thank you.
So this is a little bit unusual, but it's absolutely not unheard of. And one of our professors at Tufts wrote a paper on this about 10 years ago, 15 years ago, Michael Kahn, K-A-H-N. So just like with your fingers and your toes being sensitive to cold, your tongue can be sensitive to cold. The nerves or the pulp inside your teeth can be sensitive to cold. And another one of our professors at Tufts, Dr. Charles Rankin, did a case report on a patient who, because of Raynaud's, had to have root canal treatment on 10 different teeth. So if this is a problem for you, it's very important not to drink or eat very cold things, which I know is horrible, but it's much worse if the cold causes either temporary damage to your tongue or permanent damage to your teeth. And I know that having scleroderma can take away a lot of things. It can take away your ability to put your lips together to kiss someone or to put your arms around someone to hug them. In the case of someone who is prone to having Raynaud's in their tongue or in their teeth, it can take away the joy of having a dish of ice cream.
Right, Dr. Leader. I just have a query over here. So there are times when this particular scenario or Raynaud's is triggered by stress also. Like we can avoid eating cold food, we can avoid going to cold temperature. But if under stress this happens, anything we should be careful of regarding our tongue?
Well, yes, just don't have any stress.
Right, that's such a wonderful advice, right? Thank you, Dr. Leader.
It is not only about stress, but whenever expressing any feelings or throwing your heart out, every time I speak and my tongue is white. So the tongue tip is white. It's really difficult to get that in control.
Shruti, what some physicians will do to help with Raynaud's is they prescribe a medication called a calcium channel blocker. And a calcium channel blocker makes it so that the very small blood vessels, the capillaries, don't tighten up so much when you get cold. So if you speak to a physician about that, they may be able to help you with that. That's not something that a dentist can prescribe, of course. But then the thing that a dentist needs to worry about is people who take calcium channel blockers are more likely to have their gums get swollen.
Okay. Okay, thank you.
You're welcome.
That's interesting to know, Dr. Leader. So any other questions, if anybody is having, you can either type it out on the chat window or you can unmute yourself and ask yourself. So it seems that was the last question for today. And I would like to really thank you. Thanks, Dr. Leader. Thank you, Sneha, and thank you, Alison. And thank you, Dr. Leader, firstly, because under whose guidance this presentation has been possible and under whose guidance, this whole project can be made successful. Thank you, all three of you, for taking out time today. I know this is Saturday morning for all three of you, pretty early morning. So Scleroderma India would like to thank all three of you for taking out time, to prepare all this and giving us a lot of guidance. And there's one thing which I would just like to share with our Indian friends. The products which have been talked about in today's presentation, most of the products, they are available on Amazon India. So you need not worry about, those particular products, whether they are available in India or not, because these people, they have experience in US market. I've checked those products. Most of them are available on Amazon. If you're not able to get them in your local market, you can just check them in on Amazon. And even then, if there is something which is not available, you can just check with your doctor about those products. Thank you so much. Thank you for joining. And we'll be sharing this presentation with all of you. And this video is available on Facebook right now. And in a day or so, it will be available on YouTube on our channel. Thank you, everyone. Anything, Dr. Leader, any parting notes or anyone out of the panelists today would want to share any parting notes today?
No, go ahead, Dr. Leader.
Thank you all so much for inviting us, and thank you, Neetu, for being such a great host. Sneha and Alison, you did a wonderful job.
Thank you.
Thank you. Yes, and just thank you so much, everyone, for attending and for listening to us. And we really hope that we were able to give you some guidance and some help and tips in your journey.
Oh, also, I wanted to welcome Sachi Basin. Sachi is a student at Emory University. I invited Sachi to join us. She's a pre-medical student.
Hi,
Great.
Sachi.
Welcome, Sachi. Welcome, Sachi, to this forum. It was really wonderful having you here. And it was a privilege for all of us in India to actually, listen to all three eminent speakers, because I have seen Dr. Leader's work. He has been working with a lot of organizations related to scleroderma, and he's doing a lot of research with them. So it has been a privilege working with all three of you. Thank you so much.
Thank you. Thank you so much.
Thank you.
Bye, everyone.
Bye. Have a nice day.
Bye.
Thanks, Sachi.
Thank you.